Part 3 of Chapter 14 of Special Populations will review neuromuscular disorders and other orthopedic conditions. First, we will look at neuromuscular disorders. Neuromuscular disorders are conditions in which the nerves in the body improperly function. This improper functioning affects communication between nerves and muscles. Consequently, the muscles do not function as they should. The first neuromuscular condition we will look at is cerebral palsy. Cerebral palsy is a brain and nervous system condition that develops in utero or within the first 2 years of life. Cerebral palsy occurs during brain development. Suspected causes of cerebral palsy include in utero brain hypoxia, bleeding, or injury, a genetic condition, or a neurological disorder. Damage and abnormal development occur to the portion of the brain responsible for the spinal nerves and motor control. Therefore, this causes problems with a person's motion, motor control, reflex capability, balance, muscle tone, and posture. CP can also affect oral motor function, including swallowing and speech. Signs and symptoms that we typically see with cerebral palsy include contracted joints and resultant loss of range of motion, shortened musculature and resultant inflexibility, lack of coordination, deficiencies in fine and gross motor skills, and delays in motor and speech function while growing from infant to child. These signs and symptoms range from mild to severe depending on the case. Most importantly for cerebral palsy athletes, exercise can decrease the condition's signs and symptoms, which include reducing muscle spasticity and contractures and increasing mobility and muscle tone. Physical activity can also promote the athlete's well-being, independence, and social interaction with others. There are a couple different things we need to be aware of when programming for cerebral palsy. Cerebral palsy athletes may need to use a wheelchair to mobilize. These wheelchair-bound individuals may have increased lower extremity symptoms as compared to cerebral palsy athletes who can ambulate. Overall, we need to include flexibility, aerobic, and strength training exercises in order to facilitate performance activities of daily living for these individuals. The exercises should focus on gaining muscular endurance so the athlete can withstand the stresses of activities of daily living. Many athletes with cerebral palsy are able to perform aquatic exercises, including swimming. The specific activities included into the exercise program greatly depend on the severity of the individual's cerebral palsy. Next, we will look at multiple sclerosis. Multiple sclerosis is a disease that affects the central nervous system. Nerve damage occurs due to inflammation of the myelin sheath that covers the nerves. In this case, scar tissue develops around the nerve. The nerve damage and scar tissue cause the nerves to malfunction. Overall, the cause of MS has not been determined, but autoimmune responses, the environment, genetics, and pathogens are currently being studied to determine the exact cause. Signs and symptoms of MS can be mild to severe and include loss of sensation in the extremities, muscle tremors, spasm, weakness, incoordination, paralysis, and fatigue. Athletes with MS may also be sensitive to heat and have loss of bladder control. Overall, exercise benefits athletes with MS in the same manner as athletes without MS. Exercise can assist an athlete with multiple sclerosis by increasing mobility, flexibility, strength, endurance, and well-being, while decreasing spasm, stiffness, fatigue, and depression. You should be informed of the athlete's medical condition and medications along with their side effects before engaging them into a program. Those individuals with multiple sclerosis may also be unable to maintain adequate blood flow to the muscles during exercise. This inadequate blood flow can cause difficulty with sustaining exercise and may cause fainting during exercise. The MS disease progresses over time, and symptoms may become exacerbated due to the condition's progression, but not due to exercise. Therefore, over time, your athlete's exercise program may need frequent modification. Aerobic, strength, and flexibility training should be incorporated into the athlete's exercise programs. Although there is no specific regimen that exists, athletes with MS can perform aerobic and strength training activities utilizing the FIT principle. Flexibility exercises are performed each day, and many athletes with MS have decreased or no sweat production. Therefore, it is important that we make sure that they avoid heat and are hydrating well. Our third and final condition of the neurological condition is spinal cord injury. Severe injury creates partial or complete loss of function in the torso and all extremities. The injury could cause an athlete to become quadriplegic or tetraplegic, or of the lower extremity, which is paraplegia, and causes reduced or complete inability to perform gross motor function. Exercise for these individuals assists the athlete in decreasing muscle contraction and spasm while increasing range of motion and flexibility of the movable limbs. Before we devise an exercise program, we need to determine if the athlete has any special considerations due to the spinal cord trauma. We need to always work closely with the supervising athlete's physician, as well as closely supervise the athlete during exercise. Quadriplegic individuals, in particular, do not adapt well to extreme heat or cold. Consequently, the athlete needs to exercise in a comfortable, controlled environment. If the athlete uses a wheelchair, he or she consequently may develop pressure sores from prolonged sitting. We must learn the proper way to perform lifts and transfer from equipment to wheelchairs and vice versa from trained professionals. If the athlete has core body deficiency or paralysis, we need to use belts or straps to make sure he or she is safely stabilized while exercising. If the athlete has hyper or hypotension, we need to monitor her or his blood pressure before and after exercise. In addition, have the athlete empty his or her bladder, bowel, and urine or colostomy bag prior to exercise. If the athlete has any signs or symptoms of fainting, change in color, dizziness, nausea, or extreme weakness, then we need to stop the exercise immediately. The exercise program should include activities within the individual's capabilities. Some activities include mobilizing the wheelchair, utilizing parallel bars to ambulate, manual resistance exercises, neck active range of motion, and extremity passive range of motion. Aerobic exercises can include swimming, seated aerobic classes utilizing arm movements only, and wheelchair cranking. Specifically, the paraplegic athlete can participate in aerobics class instruction with able-bodied athletes performing upper and core body activities in order to promote social communication. Strength training exercises include free weights, bands, and tubing. We need to begin the athlete's aerobic and strength training exercises slowly, using the FIT principle as is done with able-bodied athletes. Flexibility exercises are performed daily and before and after exercise. Now we will move on to orthopedic conditions. Orthopedic conditions can affect any individual at any age. Unfortunately, as we get older, our bodies cannot adapt to stress in the same manner as when we were young. Exercise helps athletes to decrease the effects of two common orthopedic conditions. These include arthritis and osteoporosis. Arthritis is a chronic condition that involves inflammation of the joints. Arthritis typically affects middle-aged men and women. The condition is caused by cartilage breakdown within the joints. After this cartilage is broken down, the bones rub against each other. The rubbing causes inflammation, joint pain, swelling, and stiffness. Arthritis can also be caused by infection, injury, or autoimmune condition. A specific type of arthritis that we see is osteoarthritis, otherwise known as degenerative joint disease, especially in older adults. This is the most common type of chronic arthritis. Osteoarthritis is caused by the wearing down of joints' bone surface, which occurs within the aging process. Osteoarthritis cannot be healed, but the symptoms can be treated. Rheumatoid arthritis is another type of arthritis. This is an autoimmune disease characterized by synovial membrane inflammation around the joints. For both of these types of arthritis, exercise is beneficial for arthritic adults. Typically, an arthritic individual is deconditioned due to inactivity and joint pain. Therefore, we need to educate the individual and explain how moderate exercise can improve his or her quality of life. Improvements in cardiovascular status and other areas can be gained with only 30 minutes of daily exercise. Active range of motion and flexibility exercises performed at the arthritic areas help to decrease stiffness and increase range of motion during activities of daily living. The athlete can increase his activity level and energy expenditure on a daily basis. When we develop an athlete's program, we need to begin the exercises at a low intensity and duration. We should include flexibility exercises daily, but the athlete needs to make sure that we do not overstretch the area. Strength training can include any activity that a non-arthritic athlete can perform, including circuit training, dumbbells, weight machines, band, and tubing. We need to also make sure that they're wearing proper footwear during exercise. If at any time pain or swelling develops, have the athlete stop the causative exercise and modify the program at that time. Lastly, we will look at osteoporosis. Osteoporosis affects both men and women, but it is more pronounced in women aged 50 years or older. Over time, our bones become thin, brittle, and weak. As we get older, the body does not create bone to replace lost bone. Consequently, osteoporosis occurs. Osteoporosis causes the bone to be at risk for fracture. In later stages, the individual may have pain and point tenderness around the area of decreased bone density. Exercise for these individuals, especially weight-bearing exercise, is crucial. Weight-bearing exercises assist the bones in maintaining their density and strength. Therefore, weight-bearing exercise can help slow down progression of this condition. The athlete can perform exercises as per the FIT principle like other conditions we've talked about. Strength training activities can incorporate any type of resistance equipment. Flexibility and functional activities are also incorporated to improve range of motion and ability to perform activities of daily living, respectively. An athlete's diet must also have increased calcium and vitamin D intake, and the athlete's diet needs calcium supplementation as well as high calcium foods. Those athletes with osteoporosis may have a fear of falling and breaking a bone, and we need to educate them on how to create a wide stance during exercises.